OCD is not just overthinking. It's not just being too clean. It's a brain condition that can trap a person in a loop of fear and rituals. But here's the truth. OCD is treatable. Obsessive compulsive disorder, or OCD, has two main components. Obsessions, intrusive, unwanted thoughts like fear of contamination, doubt, or harm, and compulsions, repetitive behaviors like washing, checking, or counting, done to reduce anxiety. But relief is temporary and the cycle continues. This happens because of dysfunction in specific brain circuits, especially the cortico-striatothalamocortical loop. OCD treatment follows a step-by-step approach, from medicational to therapy to advanced brain-based interventions. Let's break it down. First-line treatment, SSRIs or selective serotonin reuptake inhibitors. Common medications include fluoxetine, sertraline, fluvoxamine, paroxetine. These medications increase serotonin, helping regulate obsessive thoughts. Key point, OCD often requires higher doses than depression, and it may take 8 to 12 weeks to see full results. If response is partial, doctors may add augmentation strategies. Nutrition is supportive, not a primary treatment, but certain nutrients can help brain function. Omega-3 fatty acids and acetylcysteine helps regulate glutamate, vitamin D and B12, and even gut health through probiotics. But remember, this is supportive, not a replacement. Next, cognitive behavioral therapy, or CBT. It focuses on identifying distorted thoughts, challenging irrational beliefs, and improving thinking patterns. But for OCD, CBT is most powerful when combined with ERP, exposure and response prevention. ERP, this is the gold standard treatment for OCD. Here's how it works. You face your fear and resist the urge to perform the compulsion. Example, fear of contamination. You touch something dirty, but don't wash your hands. At first, anxiety rises. But over time, your brain learns something powerful. The fear is not dangerous, and the anxiety starts to fade. For treatment-resistant OCD, we have advanced options like transcranial magnetic stimulation, TMS, and deep TMS, sometimes called the OCD helmet. Devices like the BrainsWay Deep TMS system use magnetic pulses to target deep brain regions like the prefrontal cortex and anterior cingulate. It's non-invasive and FDA approved for OCD. Another emerging method, TDCS, or transcranial direct current stimulation. It uses low electrical currents to modulate brain activity. Still experimental, but promising. For severe treatment-resistant cases, there is deep brain stimulation, or DBS. A surgical procedure where electrodes are implanted in the brain. It directly targets the circuits involved in OCD. Highly effective, but invasive and used only in extreme cases. So the typical approach is start with SSRIs plus ERP, add CBT strategies. If resistant, increase medication or add augmentation, then consider TMS or DTMS, and in severe cases, DBS. OCD is not a weakness. It's a brain-based condition and it can be treated. With the right combination, science and support, people don't just manage OCD, they regain control of their lives. Follow Mind Power Wasim, where science meets the mind and real transformation.